Okay. Today we'll start with another one blood disorder, that is erythroblastosis fetalis. Another one, the blood disorder that is related with the congenital blood disorder. Okay, that is known as hemolytic anemia. See here, this type of blood disorder only in the related with the blood, and this one is known as there is a lysis of the RBCs. Okay, destruction of RBCs. Due to that, there are so many problems which occurs that the RH incompatibility results from the distress of the fetal blood brought about by the reaction between the maternal and blood factors. Okay, जैसे कि मदर से बेबी को जो जाने वाले ब्लड होता है, there is a destruction occurs due to the congenital hemolytic anemia. There is an RH incompatibility causes, it causes the what erythroblastosis fetalis. See, ये जो फैक्टर होता है RH factor named after the rhesus on monkey was discovered by the Landstein and Wenner in the 1940 as a factor in human RBC that would react the rabbit antiserum produced by the administration of RBC. ओके, जैसे इससे जो होता है, जैसे एंटीसीरम जो निकलता है लेने के बाद द प्रोड्यूस जो एडमिनिस्ट्रेशन करते हैं किसमें आरबीसी फ्रॉम द रेसस मंकी ऑन द जिस मंकी के ऊपर द डन बाय लैंसटन एंड वेबिनार टू आइडेंटिफिकेशन ऑफ द हाउ द hemolytic anemia occurs and it how it causes the due to the RH incompatibility. Okay. In pathogenesis, Erythroblastosis fetalis is an essential due to inheritance by the fetus of the blood factor from the father. जिसे जो फादर से जो होता है इसके जो फैक्टर्स डिफिशिएंसी जो होता है दैट एक्ट एज एन फॉरेन एंटीजन टू द मदर। ये अपने बॉडी में मदर का फीटल के बॉडी में क्या एक्ट करता है, ये फॉरेन एंटीजन जैसे बिहेव करता है। Transplacental transfer, through the transplantation, the placenta through transfer of the this antigen transplanted the leaks of the RBC. जैसे कि transplantation होता through the placenta, it is also known as transplant leaks in the RBC also entered into the RBC cells. From the fetus to the mother, fetus से mother, immunization of the mother through the RH factor, formation of the antibodies in the mother to giving the RH factors after the delivery of or 72 hours. Okay, when transferred back to the fetus by the same route, जैसे कि जाता है वैसे वापस आता है. Okay, produce the fetal hemolysis. अगर इसको टाइम पे अगर नहीं देंगे RH factor 72 आवर में, ये जो कॉज होने का चांसेस रहता है, दैट इज प्रोड्यूस द fetal hemolysis. तो जाना और आना, okay, immunization of the mother through the RH factor, formation of antibodies कर दिया. Suppose when transferred back to the fetus by the same route, produce the fetal anemia. अगर नहीं वापस आ जाता है, अगर before administration of immunization, it is the transportation of the blood from the fetus to mother, mother to fetus. Suppose once immunized to the mother, that forms the antibodies in the mother. So again it comes through the same route by transplacental, it causes the produce the fetal hemolytic repeaters hemolytical process. Okay, if both the parents are homozygous, दोनों सेम है, RH पॉजिटिव, infant will be RH positive, no maternal amnion. Suppose देखो यहाँ पे क्या है, दोनों homozygous जाइगोसली है, the same factors positives है, तो no maternal immunization. If mother is homozygously positive but father is RH negative, no maternal immunization. यहाँ पे maternal immunization करें जनरल. Suppose उस टाइम क्या है, father positive है, RH negative mother है, तो no immunization for the mother. If father is negative, RH positive negative, and mother is RH negative, fetus inherit the parental factors, which may act as an antigen to the mother and immunize her with the resultant antibody formation. इसलिए इस टाइम क्या है, इनको antibody antigen देके जो immunize the her mother her with the resultant antibody formation. एंटीबॉडी फॉर्मेशन के लिए हम इम्यूनाइजेशन करते हैं ताकि बच्चा RH पॉजिटिव फैक्टर से सफर ना हो. ये जो सिस्टमेटिक डायग्रामेटिक देखो, यू कैन अंडरस्टैंड बाय दिस रूट. सपोज द मदर फादर इज RH पॉजिटिव, मदर RH नेगेटिव. देखो ये फीटस है, पॉजिटिव है, मदर पॉजिटिव है, मदर नेगेटिव है या पॉजिटिव है. ओके, RH negative mother carrying her first RH positive fetus, RH antigen from the developing the fetus can enter the mother's blood during the delivery. जैसे पहले क्या होता है, RH पॉजिटिव मंत्र होता है बच्चों में, सेम रूट बच्चा पैदा होता है इसलिए RH पॉजिटिव. In response to the fetal Rh antigen, the mother will produce the anti-Rh antibodies in the body. Anti-Rh antigen डेवलप होता है, उस टाइम क्या है, बेबी में बॉर्न विथ Rh नेगेटिव. See, if the woman becomes pregnant when the another Rh positive fetus, her antigen antibody will be cross the placenta. So इस टाइम क्या होता है, Rh नेगेटिव क्रॉस करता है प्लासेंटा को, will cross the placenta and damage the fetal red blood cells. यहाँ पे क्या करता है, once it cross the placenta, the mother is having the Rh positive, तो automatically क्या है, baby while going through blood while going through the placenta, it cross the placental barrier, placenta to cause the Rh incompatibility, means crisis or lysing of the RBC cells in the body. See, clinical features. Some infants are stillborn, जो baby born होता है stillborn से, okay, then anemia with the pallor, jaundice, compensatory erythropoiesis, fetal hydrop. See, these are what looks a fetal fet- fetal erythroblastosis fetalis. Okay. In oral manifestations, looks deposition of the blood pigments in the enamel and the dental. देखो, ये blood spots है, pigments है, yellow pigments है, due to the RH incompatibility. Ground sections negative, positive test for bilirubin. See here, ground sections पॉजिटिव टेस्ट फॉर बिलिरुबिन, बिलिरुबिन पॉजिटिव रहेगा, जॉन्डिस तो रहेगा ही. इंटर्नसिक स्टेन्स इन द बॉडी, एनामल हाइपोप्लेजिया, इनामल द हाइपोप्लेजिया को डार्कनेस जैसे होता है, ये देखो डार्कनेस हाइपोप्लेजिया होगा, RH हम. ओके, दीज आर द अनदर ओरल मैनिफेस्टेशन ऑफ द erythroblastosis fetalis. Then laboratory findings. Here, RBC count decrease, large number of normoblasts और न्यूक्लिएटेड रेड सेल. यहाँ पे क्या होता है, आरबीसी कम्प्लीटली लॉस होता है, बट यहाँ लार्ज नंबर ऑफ नॉर्मोब्लास्ट एंड द न्यूक्लिएटेड रेड सेल्स बढ़ जाता है. ओके, बट इटरस इंडेक्स हाई इन द इटरस में, द पॉजिटिव direct Coombs test to be problem. I will show you how it can continue. Positive for direct Coombs test on the cord blood will be conducted on the laboratory. Treatment है, at present, Rh negative mothers are being given NTD gamma globulin to prevent the immunization. Okay, so यहाँ पे क्या है? Best treatment for such type of Rh negative mothers are being given NTD gamma globulin to prevent the immunization. दिया जाता है. Then another one disease है, that is thalassemia. See here, the thalassemia is a group of genetic disorder of the hemoglobin synthesis characterized by disturbance of either alpha or beta hemoglobin chain productions in the blood. See, जो connections होता है, जो chain रहता है alpha and beta का, वहाँ पे क्या है, disturbance हो जाता है. Due to that, that cause the thalassemia. See here, thalassemia, one of the genetic disorder तो है ही. Hemoglobin synthesized characterized by disturbance of either alpha or beta cell cells. Hemoglobin synthesized हो जाता है, बंद कर देता है, और hemoglobin chain would become disturbed. Once the chain formation become disturbed, that leads to the, वहाँ पे भी hemoglobin कम होगा, thalassemia. And estimated 9, मतलब इंडिया में, वर्ल्ड वाइड में 9 lakh births are expected to occur in the next 20 years with the clinical significant thalassemia disorders. उसके चलते वो डिस्कवरी किया गया है. First described by the Thomas B. Cooley in the 1925. Very important है, one mark है, Thomas B. Cooley in 1925. Then thalassa means seed in a Greek word. Thalassa, Greek word में इसको बोला जाता है seed. Okay. Pathogenesis. Normally, how this process will be occurs. Normal adult hemoglobin HbA. Heme is conjugated to the globulin. The globulin two pairs of alpha chain and beta chain. जो globulin होता है प्रोटीन, वो अल्फा एंड बीटा चेन से बना हुआ होता है. Then see here in the thalassemia group of anemias में क्या होता है, heterogeneous groups, various different group रहता है. वहाँ पे diminishes the synthesis of alpha chain and beta chain of hemoglobin. In the presence of hemoglobin in A, there is a connection of this protein hemoglobin that leads to what? The diminish the synthesis of the become the chain, formation of the chain. Thalassemia A and thalassemia B. Thalassemia A and thalassemia B. It is deficiency synthesis of alpha chain, deficiency of the synthesis of beta chain. See, once the chain axis become cut or crossed, producing the unstable hemoglobin. अगर ये chain अगर disturb हो जाता है, pressed हो जाता है, ड्यू टू द वेरियस कॉज, ओके, हो सकता है अल्फा द causes, but unstable hemoglobin, the proper formation of hemoglobin will be does not occur, डैमेज द एरिथ्रोसाइट्स, आरबीसी प्रोडक्शन बंद कर देता है, डैमेज करता है, वल्नरेबिलिटी टू डिस्ट्रक्शन, वो मजबूर कर देता है वो टू बी हाउ द causes of what? Destruction of the RBC. In heterozygotes, the disease is mild and is called as a thalassemia minor or thalassemia tract. इसमें होता है इन मल्टीपल जो जाइगोट्स होता है जैसे डिफरेंट डिफरेंट कैटेगरी का, उसमें क्या है थैलेसीमिया माइनर बोलते हैं, रिप्रेजेंट बोथ अल्फा एंड बीटा थैलेसीमिया. इन होमोजाइगोट में सीवियर फॉर्म कॉल्ड थैलेसीमिया मेजर और बीटा थैलेसीमिया, अल्फा एंड बीटा थैलेसीमिया, बीटा थैलेसीमिया, कूलीज एनीमिया जिसको हम बोलते हैं, नाम itself is known as Cooley's anemia. The production of the beta chain is markedly decreased. In the formation of the alpha and beta chain, there is no production of the beta chain. Markedly decrease हो जाएगा, automatically decrease हो गया, तो that cause the what? Chronic or thalassemia major बोलते हैं. Consequent decrease in the synthesis of total hemoglobin occurs severe hypochromic anemia. See here in this case, suppose there is a decreased synthesis of the chain, or either it is alpha or beta. Suppose it is alpha chain synthesis में deficiency होता है minor thalassemia, beta chain synthesis कम हो गया तो there is Cooley's anemia, तो major anemia thalassemia. See, furthermore, excess alpha chain which synthesize at a normal rate. Suppose चेन ज़्यादा है, अल्फा प्रोडक्शन ज़्यादा है, बट सिंथेसाइज में रेट में कम है, precipitate to insoluble inclusion body within the erythrocyte and their precursors. जो होता है जैसे सोने से भी वो रही ना, so जो whatever amount are increased in the RBC on the productions, that increases the size or the numbers that will not be accumulated in the particular place, that will be evacuated from the particular place, or it cause the another complications in the blood. It may it wherever कहीं जाके वो डिपॉजिट हो सकता है. See here, fetus bodies देखो, इंट्रासेलुलर इंक्लूजन्स बॉडीज लीड्स टू इंक्रीज द एरिथ्रोसाइट्स. यहाँ पे क्या होगा, अगर बढ़ेगा तो मैंने जैसे बोला ना वहाँ बढ़ेगा तो इंक्रीज द एरिथ्रोसाइट हिमोलाइसिस एंड सीवियर इनइफेक्टिव हीमेटोपोएसिस. यहाँ पे क्या होगा, इनइफेक्टिव हीमेटो द ब्लड पोएसिस जो होता है ना इंक्रीज हो जाता है. Other forms of thalassemia major that represent the alpha thalassemia are one hemoglobin H diseases, hemoglobin Bart's diseases. Very mild form में होता है, very bad disease में, with the hydros fetalis in which infants are stillborn or die shortly after the birth. Baby तो born होता है, but infantly shortly मर जाता है. इसलिए hydros fetalis like swollen liver, severe abdominal swelling like symptoms are occurs in the babies. Clinical manifestations in the thalassemia cases occurs within the first or 2 years life, right? Siblings are commonly affected. 1 to 1 generation में तो हो ही जाएगा siblings में. Yellowish pallor of the skin yellowish paralysis रहेगा. Fever, chills and malaise. Generalized weakness, splenomegaly and hepatomegaly is the common clinical manifestation of the thalassemia. नेक्स्ट इट डेवलप्स मैंगुलर फीचर्स ड्यू टू द प्रोमिनेंस ऑफ द चीक्स. सपोज देखो जैसा होता है ना चीक्स वगैरह, देखो इसको रोडन फेसिस बोलते हैं, रोडन फेसिस. रोडन जानते होंगे ना, वैसे जो फेस होता है ना वैसे बनता है इन द थैलेसेमिया केसेस में. डेवलप्स द मंगोलाइड फीचर्स, मंगोलाइड कैरेक्टरिस्टिक्स रहेगा ड्यू टू प्रोमिनेंस ऑफ द चीक्स. चीक्स प्रोमिनेंट है. प्रोट्रूशन ऑफ द मैक्सिलरी, ये देखो मैक्सिलरी प्रोट्रूशन है, एंटीरियर टीथ प्रोट्रूशन है. Depression of the bridge of the nose. See, the bridge of the nose become depressed. This is the symptoms of the what? Thalassemia. In the oral manifestation, unusual prominence of the premaxilla and anemic pallor observed in the oral manifestation. Laboratory findings में suppose hypochromic macrocytic identification, RBC, WBC, bone marrow assessment, cellular hyperplasia with a large number of immature or primitive and stem from the RBCs. अब assessment करना है. Supravital staining, methyl blue demonstrate inclusion on the bodies should be conducted after thalassemia cases. Okay. Radiographical findings. Suppose in the noted middle, in the middle and anterior portion of the rib, long linear density within or overlapping the medullary space, the space of the rib and running parallel to its long axis. जो एक्सिस होता है रिब्स का लॉन्ग एक्सिस से completely parallel रहता है। हेयर एंड हेड अपीयरेंस, हेयर ऑन एंड, देखो ऐसा दिखता है वो हेयर है बट एंड हो गया, ऐसे लुक्स, देखो एक्सरे लुक्स हेड का है, एक्सरे है, देख लो कैसे दिखता है। Salt and pepper effect, peculiar trabecular pattern of maxilla and mandible, apparent coarsening of some trabecula and a blurring and disappearance of the others in the radiological finding. We'll show one video on the thalassemia. Okay. Treatment like blood transfusion, temporary for remission कर सकते हैं, bone marrow transplantation का treatment है. See, in the megaloblastic anemia and vitamin B2 deficiency, another one main disease is that is megaloblastic anemia and vitamin B12, that is cobalamin deficiencies. Okay, इसको बोलते हैं anemia owing to decrease the production of RBCs. Here, it is an adult form of anemia that is associated with the gastric atrophy. Adult form of anemia is उसमें formations only in the adults and loss of intrinsic factor production in the gastric section. जो intrinsic factors होते हैं, that will be going to be decreased in the secretion while digestion during the time of breakdown of the process of the food. That time the intrinsic factors will not be released. That leads to the deficiency of vitamin. So what required by the body. Okay. Rare congenital autosomal recessive form. In the autosomal disease resulting from the autoantibodies, self जो develop होता है, directed against the intrinsic factors, a substance needed to absorb the vitamin B12 from the gastrointestinal tract and the gastroparietal cells in the which are present in the gastric juice or in the intestine. See, vitamin B12 and erythrocyte maturing factors are present. Okay. Then clinical manifestation in related to blood, megaloblastic, macrocytic anemia बोलते हैं इसको, megaloblastic anemia, pancytopenia मीन्स leukopenia और thrombocytopenia बोलते हैं. न्यूरोलॉजिक में पैरास्थेसिया लाइक सिम्टम्स, नमनेस रहेगा, पैरास्थेसिया, टिंगलिंग, pain, numbness of hands and feet, peripheral neuropathy, muscle weakness, impaired sense of smell, syncope. In psychiatric condition में fatigue, irritability, personality changes, mild memory impairment, depression. Cardiovascular increased risk of myocardial infarction and stroke. This is the increase in the megaloblastic anemia. See, oral manifestation, burning sensation in the tongue, like as usually due to the megaloblastic or vitamin B12 anemia, burning sensation in the tongue, lips, and buccal mucosa and other mucosal tissues. Burning sensation I hope. The tongue is generally inflamed, often described as a beefy red in color. The tongue is generally inflamed, often described as beefy red. पूरा completely red, beefy red color दिखता है. Okay, once it deficiency disorder. Characteristically, with the glossitis, glossodenia, and glossopharosis, there is a gradual atrophy of the papillae, tongue, and eventually in the smooth or bald tongue. जैसे देखो ये जो टंग है ना दिख रहा है, जैसे इमेजिनेशन में बाल्ड टंग दिखता है. ओके, जैसे बीफी रेड टंग, बाल्ड टंग, ग्रेजुअली टंग बिकम मोटा टाइप का लगता है, ग्रेजुअली अट्रोपी टाइप का टंग दिखता है. हंटर्स ग्लोसाइटिस और मोलास ग्लोसाइटिस बोलते हैं. Then gum become also the bleeding type लगेगा. Okay, period in appearance of the tongue may be undergo periods of remission. Recurrent attacks are common. Then while eating, difficulty to swallow. Okay, taste alteration have been reported. Suppose automatically taste नहीं लगेगा, difficulty in swallowing है, everything will be. In laboratory findings, blood RBC count is seriously decreased upon to 1 lakh cubic mm. Automatically come on there. Microcytosis is one of the chief characteristic features, although variation in the shape of the cells present. इसको बोलते हैं paikilocytosis. जो shape of the cells changes होता है, that is known as a paikilocytosis. Pear or teardrop shape erythrocytes like looks like a pear and teardrop का RBC cells दिखेगा, erythrocytes are present. Increased hemoglobin content, mild to moderate thrombocytopenia is noticed. In serum, indirect bilirubin may be elevated. ऑटोमेटिक जो दिखता है ना अंदर बॉडी में डेवलप हो जाता है. सीरम लैक्टिक डिहाइड्रोजनेज इज मार्कली इंक्रीज. Then serum potassium, cholesterol, and nucleic phosphate also need to be increased. Then bone marrow, hypercellular and show the lineage differentiation can observe in the bone marrow. Treatment है weekly intramuscular injection 1000 microgram of vitamin B12 for the initial 4 to 6 weeks तक देना है, followed by 1000 microgram per week indefinitely. Delayed treatment permits progression of the anemia and neurological complication. अगर treatment लेट करोगे वो neurologically डिफेक्ट्स करता है ताकि प्रॉपर वे से नहीं हो सके. ओके, also नहीं एक ब्लड टेस्ट का दिखाना है. Hemolytic analyzed typical sickle cell, non-maternal, RH incompatibility, jaundice, depression, blood segment, transection, and medium fetus index. Erythroblastosis fetal में osteotests करते हैं, that is
In this video, we will discuss the Coombs test, and before discussing the Coombs test, it is very important to understand the concept of the autoantibody. So this is an RBC, and on the surface of the RBC, there are lots of antigens. For example, the ABO blood grouping antigens, the RH antigens, and many others. And some conditions of the body, for example, the immunohemolytic anemias, the body produces certain types of antibodies which are directed against these antigens, and these antibodies attach to these antigens and cause immune mediated destruction of the RBCs and lead to anemias. And this antibody is known as the autoantibody. And the Coombs test is a test which is done to detect these types of antibodies. So there are two types of Coombs test, the direct type and the indirect type. And the common thing in both of them is the Coombs reagent. And it's very important to understand the Coombs reagent, how it is made, what is it, to understand the basics of the Coombs test. So let's first understand how is the Coombs reagent made. Please excuse me for my drawings, but let's suppose this is a human, and the body of this human contains lots of these autoantibodies. So what we do is we take the blood from this human and we separate the serum from this blood, which contains all of these autoantibodies. And what we do next is that we inject this serum into an animal. Please don't ask me what type of animal is this, it just is. Now, the immune system of this animal recognizes these antibodies as foreign and produces its own antibodies against these. And what we do next is we take the blood of that animal and separate those antibodies which the animal has just produced against these autoantibodies. And we harvest those antibodies, and this is the Coombs reagent. So the Coombs reagent is nothing but the antibodies which the body of the animal has produced against these autoantibodies. Let's first talk about the direct Coombs test. And out of the two types of the Coombs test, this is the one which is used to detect the immunohemolytic anemias. So let's suppose this is a human which has immunohemolytic anemia, and his blood contains autoantibodies which are directed against his RBCs. So what we do is we take the blood sample from this patient and we put that blood into a test tube or a beaker. So here are the RBCs which are present in the blood of this patient, and here are those antibodies which are attached to the RBC surface. And to keep things simple, for the rest of the video, I will refer to these autoantibodies as blue antibodies and the antibodies which are present in the Coombs reagent as green antibodies. What we do next is we add the Coombs reagent which has these anti-autoantibodies or the green antibodies into this blood sample. But since these green antibodies are directed against these blue antibodies, when they react, they cause the attachment of these blue antibodies. And since in turn these blue antibodies are bound to the RBCs, it forms agglutinated mass of the RBCs at the bottom of the test tube or the beaker. So here is the agglutinated mass of the RBCs, and this is a visible reaction which confirms the presence of autoantibodies in the blood sample. And one of the very important conditions in which the direct Coombs test is done is the hemolytic disease of the newborn, which is also a type of immunohemolytic anemia. Now let's talk about the indirect type of the Coombs test. And this test is mainly done for the prenatal screening of females for detection of Rh antibodies. Sorry, this is a writing mistake. This is antibody, not antigen. Now let's suppose this is a pregnant female, and again, excuse me for my fantastic drawings. And let's suppose this is the fetus inside her womb. The female is Rh negative and the fetus is Rh positive. So what happens is sometimes at the time of the parturition, the fetal blood comes in contact with the maternal blood, and the maternal blood develops anti-Rh antibodies against those RBCs. And during the second pregnancy, if the fetus is again an Rh positive human, the antibodies these cross the placenta and destroy those fetal RBCs. So it is very important to detect those antibodies. So what we do is we take the blood from the female, and after some procedures like washing and centrifugation, we separate the serum from the blood, and we add the serum into a test tube, same as that of before. And here lies those antibodies, the anti-Rh antibodies. Now, here is the essential step which is different from that of the direct type of the Coombs test. Now, since the maternal blood does not contain those RBCs to which these anti-Rh antibodies will bind, so we will have to introduce externally the Rh positive blood. So the next step will be addition of Rh positive RBCs, either of the animal type or the human type, into this sample. So again, these antibodies will bind to these Rh positive RBCs. And the next step in this are the same as that of the direct type of the Coombs test. So when we add the Coombs reagent into this sample, these antibodies again bind to these anti-Rh antibodies and cause the agglutination. So agglutinated mass of RBCs is formed at the bottom of the test tube. So this was all about the Coombs test. I hope you find this video informative. Make sure to hit the like button below, and also if you want more videos, don't forget to subscribe. Thank you so much for watching this video.
Next, last one, Erythroblastosis index. Jaundice तो जानते हैं Ictus. Ictus index है मतलब वही jaundice. Okay, Ictus means that is jaundice. Examination you want to keep the baby into the light. Okay, that is known as the phototherapy. Okay, this is all about what the 1 minute. This is all about all type of thoughts, thalassemia and megaloblastic anemia. Okay. Then I think so. This one is what laboratory findings over A and megaloblastic anemia over PRDS present in the megaloblastic. Tomorrow we'll start with aplastic anemia. Thank you.